And thanks for inviting me to do this talk. I love talking about physical activity, and so I'll probably spend about 45 minutes at most, and then if there's time for questions, be happy to answer those. So I'm a professor in health sciences at Simon Fraser University in Vancouver, and I did a bachelor's degree in kinesiology, and my PhD was in a cardiac rehab program following people after they left cardiac rehab. And a lot of my research centers around physical activity for prevention and management of disease, as well as how we might be able to get people being more physically active. So I've put together a presentation to talk about benefits of activity, both in preventing heart disease and also in people who have heart disease. And then I've got a few slides where I talk about the role of healthcare professional, and that may or may not be relevant to everybody, but I thought it was quite interesting to talk about some of the things that we can look for from our health professionals in terms of supporting physical activity as well. All right, so I will begin once I get everything sorted. All right, okay. So the first thing I want to talk about is actually physical inactivity. And, you know, the average, so this is pre-pandemic, average adult might sit between 4 to 6 hours per day. And with the pandemic, we can probably add anywhere from 1 to 4 hours per day onto that amount. A lot of us are staying at home and not getting nearly as much activity. There are some people who have found that they're more active now because they're either not working as much or they don't have to commute. But there's still, I find my activity is about the same, but I'm sitting a lot more. So I have to make efforts to keep moving myself. Now, physical inactivity is a concern because it's responsible for a great burden of diseases. And this middle point here makes it the fourth leading risk factor for early death or premature mortality. And if globally, if just people increase their activity or inactivity decreased by 10%, we'd save 500,000 lives. And if it was decreased by about 25%, that would be over 1 million lives saved. Now, some of the things that we do increase our susceptibility or to sit and be inactive, and the television is one of those. And so this is one of the early studies looking at the link between television viewing and incidence or new onset of diabetes, heart disease, and early death. And you can see that with hours of television viewing, the risk or the chances go up. The one thing, though, about television viewing, I wouldn't say it's only a physical inactivity phenomena, because a lot of us may be eating, and if we're eating in front of the TV, we may not be as mindful of what we're eating, and we may be eating less healthy foods than we might sitting down at a dinner table. And there had been some thinking that if you were sitting, it was okay as long as you were active, but that doesn't seem to be the case. If you're sitting for 8 hours and go out and you're active for half an hour or an hour, that's great, and you're doing more than most people. But it doesn't remove that, being active doesn't remove the increased risk that comes with sitting, because we at first would think that, oh, well, inactivity is just the opposite of physical activity, but you can be inactive and still get exercise, and that can still be problematic. So just looking at this graph on the left here, At the bottom left corner are people who are doing a lot of activity and less activity on the right-hand side. And then it's increasing amounts of sitting. So while being active does reduce the risk of sitting, it doesn't fully take it away. There's still some increased risk, especially at the lower activity levels as well. And in Canada, when we measure physical activity using things like a accelerometer, we find that only about 20% of people are meeting the guidelines. And the guidelines are about 20 to 30 minutes of moderate or vigorous activity per day. So that would be going for a brisk walk or an easy bicycle ride or going swimming. Now, I don't hear this as much about standing being a solution as it was years ago. But if the thinking went that if sitting was bad for you, then not sitting must be good for you. But what it really is, it's not sitting itself, it's the lack of movement. Because people who are standing all day are equally as sedentary. They might be burning a tiny bit more calories than sitting. But if you're standing all day, that increases your risk for a variety of things like muscle, back pain, varicose veins, and it can also still increase your risk for heart disease. Now, people who have like the stand up and sit down desks might be moving more because they can change. But these stand-up desks are also quite expensive. And, you know, it's going to probably be cheaper for most people just to get up and walk around the house or the office or wherever they are and then go back and sit down. And over time, we do see that our activity changes, and I'm sure a lot of us are cognizant of that. What tends to happen is sedentary time at the top here creeps up. Light physical activity, for the most part, stays about the same with a slight decrease in later life. But it's really moderate physical activity, and it decreases basically almost as soon as you're born. According to this graph, you see great declines going into from a very young age to teenage, then it doesn't decline as much between 20 and 40 years, and then it declines. But this is the activity that we want to continue to encourage. And this is the type of activity, the moderate, the vigorous, that we want people to do to meet with the physical activity guidelines. So in terms of what is the value of being physically active? So there's definitely the harms of being physically inactive. Now, being at this talk, you're probably already convinced that physical activity is good for you. So I'm not going to present a lot of data specifically to that. These are data that I was involved in. It's a global study of 17 countries, 130,000 plus people. And we asked people to self-report their physical activity, whether it was leisure time, household, transportation related, or occupational. And what we found is a couple things. So just concentrate at the top here, which is all-cause death and new onset of heart disease. So this green one is looking at comparing moderate physical activity. So doing somewhere between 20 to 30 minutes to up to an hour per day, compared to doing less than 20 minutes per day. And that over the span, that resulted in a 15% over the 9 years, 15% reduction in risk. Those people who did higher amounts than that, there were increased benefits. And we also found in this blue dot here, which wasn't commonly done in other studies, where we compared people who are doing high amounts to those people who are doing moderate amounts of activity. And there is still some benefits. So there's continued benefits to increasing activity even beyond the guidelines. But how much is needed? And that's kind of a big question on a lot of people's mind. The Canadian guidelines suggest, as I've mentioned, 150 minutes of moderate to vigorous activity per week. And I want to highlight here that doing it in bouts of 10 minutes or more. So that can be that you do 10-minute walk in the morning, 10-minute in the afternoon, 10-minute in the evening, and you met those guidelines. Now, this doesn't mean that you can sit down for the rest of the day. This is moderate or vigorous activity. Light activity and reducing the amount of time being sedentary is also important. And as you see here, more physical activity provides greater health benefits. Now, going back to that same study that I mentioned, if we look on the left here, this is right where my mouse is, somebody doing zero activity. The benefits occur from that first step, going from the couch to that first step. There's not a threshold that you have to get to before you start to see benefits. And those benefits actually seem to continue in a linear fashion up until about doing maybe an hour of activity. So an hour of moderate walking. If you're doing a run, that's probably closer to like 40 minutes of running. And then they continue to, the benefits continue, but you're getting diminishing returns. But there are still people in our study, and one of the benefits of our study was we had people from lower and middle income countries who are doing a lot of activity just through their occupation. On the right-hand graph here is we've actually taken away that what we call recreational leisure time physical activity that most of us are used to doing. So this is a combination of doing household activity, walking for transportation or cycling for transportation, and occupational activity. So this graph is very similar to the one on the left. And so the premise here is that it doesn't matter how you're getting it and what context you're getting your activity. Your body doesn't care if we call it work activity or chores, you're vacuuming versus going out for a walk. It just cares that you're moving. So this is really good because then it starts to expand things that we consider to be activity that we might not have realized before. Now, I thought I would present somebody else's data as well as just mine. This is actually far more active. These are data from a large study of a few 100,000 people in China, and looking at high levels of physical activity, heart disease and deaths due to heart disease on the right here. And the amounts of activity are high. This would be equivalent. These people out here are doing the equivalent of walking 9 hours per day. So that's even higher than we saw in our study. And they're still getting some benefits as well. Diminished returns, as I said, the greatest benefits tend to be at going from nothing to something. And that's important because going back to that, thinking of that minimum 10-minute bout, we're starting to see studies show that even at smaller amounts of activity, there are benefits. And this is a study where it was looking at breaking up that sitting and how it affects your blood sugar metabolism. So this was a 5-hour sitting for 5 hours, and there were 3 groups: sitting for 5 hours straight, sitting for 5 hours, and then every 20 minutes getting up and walking. And there are 2 walking groups. There is either like a leisure kind of light walking and then a moderate walking group. And before sitting, participants were given a sugar drink, and there was blood collected every hour to see how their blood sugar levels were doing. And so both for blood sugar levels and for insulin, whether it was a light break, the light walking, or the moderate breaks, the sugar metabolism was much improved over the uninterrupted sitting. So what seems to be problematic isn't so much sitting, but it's uninterrupted sitting that's more problematic. You can counteract that by having breaks throughout periods of sitting. And one of my collaborators has been working on what he calls exercise snacks. So furthering that to that, every 20 minutes, and seeing how that can actually affect fitness. So in this study, took previously inactive individuals and then randomized them to either no activity or doing 3 flights of stairs 3 times a day, 3 days a week. And it was interspersed each time the 3 flight of stairs, it was interspersed by about a few hours. And so even that small amount improved fitness in those previously inactive people. Now, the idea of this exercise snack, it's kind of taking this high intensity interval training where you would do a warm up, you would do bouts of maybe 2 to 4 minutes of activity, maybe a minute of active rest, and then repeat that maybe 3 or 4 times, and then do a cool down. And when you're doing those bursts of activities, you're getting up to like a vigorous activity. Sometimes they're testing it at sprints. This is actually taking those intervals and spreading them out even further. Another study had demonstrated that if you spread those intervals out over, like, giving a break of 4 hours throughout the day, and maybe doing like 1 20-second sprint, 4 hours, then another 20-second sprint. Again, it's in people who aren't previously active. That improved fitness to a similar extent to people who did that all together lumped in one. And this is trying to get to the point that on any amount of activity is beneficial, but you can also do activity anywhere. It's short enough that you don't need to change or do anything. You can do squats, you can do any type of activity that gets your heart rate and breathing going for those 30 seconds to 4 minutes. Now, as a result of that evidence, in the fall, World Health Organization came out with revised guidelines. And the biggest thing, they suggested a cap, not so much that you should stop if you're doing what would be the equivalent of an hour of exercise, close to an hour of exercise per day, but that it's just reflecting that diminished returns. If you want to do more, you'll still get some benefits. But it's not, there aren't as many studies where people are doing like multiple hours of exercise to show how much benefit there is. But the biggest difference is that bouts of any duration now count. They removed that 10-minute minimum. And the reason for that is based on the studies some of the studies I presented, but there doesn't seem to be any threshold benefit of doing it in a lump of 10 minutes over doing it in, let's say, 1 minute intervals throughout the day. So that makes physical activity far more accessible. And for people over 64 years, it's the same as the above, but then they included the emphasis on doing balance and functional exercises. That can be part of your physical activity, but it's based on a lot of evidence that shows increasing coordination and mobility prevents likelihood of falls, and falls at a later age are a big cause of hip fractures and other fractures that can reduce mobility throughout the years. So what about people who have heart disease? Where does physical activity fit? If we go back to the late 80s and early cardiac rehab, because the studies had to be done because patients who had heart disease who had a heart attack, frail, and stayed in bed for 30 days in a hospital. What ended up happening, they got more deconditioned. A number of them actually died in the hospital because of blood clots that accumulated in their lungs. And so started getting people up and exercising. And these early studies were pretty much exercise only. Some of them might have included some nutrition, but the medications in the 80s for managing risk factors for heart disease weren't as robust as they are now, and definitely not as many available, but basically found that there is reducing your risk for early death over 3 years by about 1/5. Now, there's been in recent times, because with the more and more medications, sophisticated medications controlling risk factors, researchers have started to ask, do we even need cardiac rehab now? So this is a little annoyance for me, but I've just flashed through some of the studies that have looked at this, and this one's suggesting that those studies, like the ones I just presented, have little relevance now. It's unsure if there's any benefit of previous studies to exercise-based rehab now. This one says that there is still benefits, but there are challenges. People are still challenging that question. And here's another one that has looked at it. So there's been a lot of studies to look at whether exercise is beneficial. But the reality is our physiology hasn't changed. Our physiology hasn't changed for hundreds of years. If exercise was beneficial 30 years ago, 40 years ago, there's no reason to think it shouldn't be beneficial now. And this is looking at some of the studies. This is one of the studies that looked at that other research since 2000 and found still a benefit of cardiac rehabilitation. There was one that was conducted since 2016, so only looked at studies that were in cardiac rehab that were done in 2016. And there is very limited benefit here. Basically, when you see the big blob on the vertical line, it means there's no benefit. Here, there's a slight benefit in favor of exercise-based cardiac rehabilitation, but the authors concluded that it is extremely unlikely there is a worthwhile benefit from exercise-based cardiac rehabilitation on all-cause mortality. Well, this does fly in the face of all other studies. And as I said, our bodies have not changed. What's changed is other things in how we treat cardiac rehab. But there's a number of things that about these more recent studies, and I bring these up because I work with cardiologists who will say that, oh, we don't need to exercise, just put people on a bunch of drugs. Well, it's really hard to do these cardiac rehab studies now because ethically we know that exercise is a benefit, we know nutrition is a benefit, we know the medication. So in this most recent study, the control groups were getting their own form of cardiac rehab. They just weren't doing supervised exercise. They were told to exercise, but they just weren't. And they were followed for only 2 years. When we're doing, when there's any type of like statin trials or antihypertensive medication trials, they're being followed for close to 5 years. And that's because it takes time for these interventions in terms of when we're looking at long-term outcomes like new heart attacks and early death to show up. And the sample size was pretty small. But really, I wonder if we should be asking a different type of question. Given the benefits that we can see from exercise, are there any benefits for medications needed at all if people are exercising? And this is looking at endurance and resistant exercise compared to blood pressure reduction and comparing it to other medications. So regular physical activity, whether it's endurance and resistance exercise, works just as well as a hypertensive in reducing blood pressure. And as a result, there's an initiative that started probably over a decade ago called Exercise is Medicine. And this is trying to get more and more health professionals promoting exercise as well. And we're starting to see exercise get into more guidelines. It's been in the guidelines for management of people with heart disease and prevention of heart disease, but this guideline was the first one to recommend it in the management of people with cancer and cancer care. And this was out 2.5 years ago. And so we're starting to see other diseases or disciplines recognize the value and the importance of exercise. And there's a number of studies that show it improves outcomes, improves energy, quality of life. It improves outcomes, people being treated chemotherapy, as well as there are some suggestions that it also halts or slows down tumor progression. Now, from a healthcare point of view, we should be looking at exercise, and this is obviously done in cardiac rehab programs, as a vital sign. Just like when you go see the doctor, you get your blood pressure measured, your doctor should be asking, how's your exercise? And this is a screen capture from an electronic medical record in the HMO in the US, Kaiser Permanente. So they have it as a required vital sign to be asked every time a physician in their organization sees a patient, to ask about physical activity. And by having that discussion, that actually by asking, it brings up that discussion and puts exercise in the discussion of a healthcare professional. The Exercise Medicine Initiative has also provided guidelines to healthcare professionals for putting in prescriptions. When it's written down in a prescription, it tends to be more successful and more responsive on the patient side of things as well. And there's also guidelines to suggest of what health professionals can do to encourage exercise and physical activity. Now, this one's close to 20 years old, but I like this one because what seems to not get carried through in a lot of the guidelines is this very first one. Health professionals should engage in an active lifestyle themselves. Being a health professional doesn't protect you from disease. We're humans as well, and we need to be active. And there's these other ones about knowing exercise as a therapeutic modality, prescribe exercise. I have one student who's just finishing off her PhD looking at exercise lectures, or the amount of time devoted to exercise counseling in medical schools, particularly at the University of British Columbia. And across the country, we're seeing a bit more of that, but still in medical schools, we're seeing doctors trained spending more time on rare genetic disorders that they'll probably never see in their 20 or 30 years of practice than they do spending on the benefits of exercise, as well as how to talk to patients about exercise. Now, as I mentioned, physicians are human too. We have the same barriers to physical activity. This is a sample of about 300 physicians and residents in Hamilton, Ontario, saying they're too tired, it takes too much time, takes time away from family. Now, each of these things I could go through and dispute. If you exercise, gives you a burst of energy. We've talked about how there are different ways you can fit in exercise. There's the exercise snacks, using active transport as opposed to having to drive everywhere, or if you are driving, parking at the furthest parking spot in the shopping mall or the strip mall. It protects your car from getting dented and you get a bit more activity, and it may even save time of driving around searching for that physical activity, for that actually perfect parking spot. And you can always exercise with family and so forth. But the point of this is getting into, it relates to how much our health professionals talk to us about physical activity. And out of those 300, a third of them say they talk to patients about physical activity. But there's a direct correlation, and this is kind of not real data, but basically the more active a healthcare professional is, the more likely they are to talk to patients about physical activity. So if we want people to be more active, we might want to target healthcare professionals, because then that'll trickle down to us as well when we go and see our physicians. And does it work? So it does work. It works about the same as physicians talking to patients, telling them to stop smoking. And but the main barriers why physicians tend not to talk to or prescribe exercise to the patients, they're not active themselves and they don't feel properly trained. And that goes back to what I mentioned about in medical schools. And there are numerous resources that I've touched on, and this is the study that we're looking at. And early results show this is in medical students that they get probably less than 7 hours over the 4 years to talk about physical activity over the med school curriculum. And that has been increasing as medical schools increase what they are calling lifestyle medicine. So it's not just physical activity, it's about nutrition and talking about behaviors. But there's other things too that doctors and healthcare professionals can do. And this is kind of similar to cardiac rehab, or it's a grassroots program started in the States called Walk with a Doc. And this one physician was finding it really challenging because behavior change is hard. And going from not being physically active to regular exercise is a behavior change, and it's not easy. And so he decided to tell his patients that he's going to go meet at such and such park and go for a walk if you want to come and join him. And the first time he had 100 of his patients show up. And this is spread throughout the US and other countries, as you can see in the map below, and where physicians are getting out and walking with their patients, providing a role model, but social time as well among the patients, and also communicating with the doctor. So this would be like, if you're going to a rehab and your healthcare professional is exercising beside you at the same time. I'd love to do that, because then I get my exercise in as well as everybody else. There are also a lot of information websites. I write a weekly blog talking about various health activities, drscottlear.com. My most recent one was talking about SALT, and most of them are around physical activity, but touch on nutrition and other aspects of healthy living as well. But it's more than just heart disease that physical activity is good at preventing, and our bodies are all interconnected, so it makes sense that there'll be multiple benefits. There's mental well-being. Exercise reduces stress and anxiety. It helps with productivity at work. If I'm sitting trying to write something, I can't think of a sentence, I'll force myself, because the common urge is to stick there in front of my computer until I get that perfect sentence right. But I'll go for a walk and it will clear up my mind, and I'll get a comeback, and all of a sudden I can find that sentence. It's a proven treatment for reducing depressive symptoms. It's related to prevention in cancer, weight management, arthritis, a whole host of other things, builds confidence, gives us energy throughout the day as well. 2 flights of stairs gives about as much energy as walking up as 1 cup of coffee. So it does give that boost. So, and I'll end here that if we were to consider all of the benefits that exercise provides, if it was all of that was put into one pill, it would probably be a multi-trillion-dollar venture profit for any pharmaceutical company that can put all the benefits of exercise into one pill. And it's something that we should do daily as well. So I will stop there. I'll thank people from my research team that helped with this. And here are some of my coordinates if you want to email or Twitter, Instagram, or communicate through my blog. I'm more than happy to follow up. And I don't know if you don't get it, if Gord wants to send out my email or anything like that, I'm more than happy to share that. So I'm happy to entertain any questions that you might have. Okay, so I see one in the chat when you take. Yeah, so really good questions. How often and how long should it be? So the benefit that you get from the activity is based on where your starting point is. So the studies that I showed where I've demonstrating people increasing their fitness level, it's in people who were previously inactive. So if somebody's already active, so for example, take the extreme, an Olympic athlete, going down to walking going up 3 flights of stairs just 3 times a day is probably going to result in a decrease in fitness. It can also be combined with irregular activity, and the key thing is too is it gets you moving. So I would think like 30 seconds, 2 minutes. Any type of activity I think is good. So as you mentioned, stretching or yoga. The types of activities in the studies that I talked about were ones that got heart rate and breathing rates up. And so it also depends on your goal as to what it is. If you're doing your activity where you're doing moderate vigorous exercise later in the day, getting out and doing some yoga poses or stretching, or sometimes I'll just use empty the dishwasher or load the dishwasher or do some chore around the house to get in that break is beneficial. And it, as I said, it can also be a good break mentally as well. Sorry.
Oh, yeah, I'll just jump in and say thank you. I have to apologize. I'm having trouble reactivating my microphone. I was going to ask you that question. If anybody would like further questions or has further questions, certainly you can type it into the chat box for the time being. And if we don't have anything else, maybe I'll see Dr. Lear. You've mentioned sort of the benefits of exercise program, cardiac rehabilitation. Definitely with the pandemic and the third wave, there seems to be maybe some benefit to supervised exercise, but how about virtual delivery? Sometimes people struggle with motivation a little bit. Is there anything around virtual or online delivery that is supportive in terms of health benefits or getting people moving?
Yeah, and most definitely. And again, it comes down to your own motivations and desires are as well. There are, when the pandemic came, pretty much all the cardiac rehab programs shut down. About 50% of them maybe started up with some sort of virtual type of program and communicating in various different ways through Zoom. Some of it was synchronous. And so that there is definite benefit to that. And I'm a big proponent of that as well, because we've studied that over the last 10, 15 years. Because what we're seeing now in people who can't come to the face-to-face cardiac rehab, that was always the case for people who lived in outlying areas, like in rural and small remote. So those people didn't have any access whatsoever. So it's an awful situation we're in, but there's going to be some benefits of it as well. And my wife's been doing these dance classes, and with the face-to-face restrictions coming and going, she'll be like going in class and then, okay, now we're doing it on Zoom this week, and do it on Zoom for a few weeks. Yesterday, they went out to a park and did it at a park in Metcalfe. And then there's been plenty of a lot of fitness trainers have actually switched gears and offering exercise sessions over through Instagram or other types as well. I know at SFU, the Recreation Center had some of their staff doing real-time Zoom and Instagram classes. So I think there's a huge benefit to that. And that was also too when I was mentioning about thinking beyond the exercise activities. So early on in the pandemic, so a year ago, I was like weighing like my cans of jam and taking those 4-liter milk jugs, and then after we used them, filling them with water, because then that's now 9 pounds. Right? And then I'm sure in Winnipeg that probably everybody has a bag of salt in their house. Like those are pretty heavy. So because fitness equipment was one of the things that flew off the shelves as pretty fast too. So there are a lot of things you can do at home as well by just looking around what's with you.
Anybody else have any questions? It was an excellent response, and I remember myself just starting with dog food bags, doing some squats with dog food bags was my go-to.
Yeah, so so one person asked about being tired rather than full of energy after working out. So there could be a couple situations where that might be. If that's a consistent thing, it might be a reflection of something like physiologically happening. Maybe that's something you talk to a doctor or one of your local health professionals about. And because there could be two things. It could be like an actual physical thing that maybe either how you're warming up or cooling down might affect how you're feeling, but it might also be that the activity may be strenuous. The other time, sometimes for people who have depression, it may still, even though they're out exercising, we know that's helpful for most people, they still may be feeling some of that lethargy as a result. And responses can be individual. When I'm talking about all the studies, these are like average results. So we see, people who have fatigue syndrome as a result of going through chemotherapy and cancer, exercise actually helps that. But there'll be people that respond the other way. And there are some studies where some people are exercising more, but we don't see their fitness go up as much as we would imagine. And so there are individual responses to everything, but that would be something, if that's what you're continually feeling, that you might want to talk about with a local healthcare provider.
Excellent. Let's see how much else in the chat here. We'll give it another minute or two. One thing I noticed in your presentation as well, you did a great job of talking about sort of how the research around rehab is sort of my thing, but how things have changed with new medications, new stents, things like that. And one of my favorite trials to bring up is the HF Action trial in the heart failure population, where it didn't really demonstrate a significant mortality benefit right off the face, but they did find there was a reduction in hospitalizations. And one thing we almost sometimes under promote is the quality of life benefit that comes with exercise.
Yeah, and that's the thing. I think that's a culture in cardiology, and that we're in is in cardiology. It's all about whether that's unfortunately the main outcome of interest. But in other specialties, like for people dealing with diabetes or nephrologists, kidney disease, they're looking at more of these what we call patient outcomes. Quality of life is a huge thing, because in the end, if exercise adds 3 years, 4 years, 7 years to your life, you want those to be quality years. And I didn't present it here, but now that I think there have been some modeling studies that show for every minute of exercise, you get something like 4 minutes back in extended lifespan. So it's definitely a return on investment. Some things related to the pandemic that you mentioned, Gord, is people who are physically active have stronger immune systems. They have, and these are all like early studies, cross-sectional studies, but lower risk of getting infected and then having less adverse effects if they are positive for COVID as well.
Yeah, I think I saw a recent one looking at sedentary time and folks who are more sedentary having poor outcomes in response to COVID as well. So yeah, no, excellent presentation. It's always a pleasure to see you speak. So thank you greatly from all of us at Reh-Fit in Winnipeg for being willing to help out and come spend some of your afternoon with us. We greatly appreciate it, and thank you everybody as well for coming and spending your evenings with us. So I think no more questions, so we may leave it at that. And until next time, thank you again, Dr. Lear.
Okay, thanks a lot, Gordon, and thanks everybody for your attention and allowing me to come and share some information with you, and take care, and best wishes.
Wonderful. Thank you. Have a good night, everybody.
Good night.